Welcome to Standard Theory. In the previous segments, we have discussed the use of STEM psychology to evaluate the trends in communication in intelligent and impulsive communication. In this segment, we will discuss the interpretation of traditional mental illness from the standpoint of the standard theory of psychology. In a traditional sense, most diagnoses made in psychiatry and psychology by way of resources including the International Classification of Diseases, the Diagnostic and Statistical Manual for Mental Illness and the Diagnostic Dictionary are more or less based on the symptoms which are observed or presented by the patient. These symptoms, by the view of standard theory, are almost entirely related to the process of compensatory behavior. These observable behaviors can be considered to be the attempt to resolve some level or cycle of communication in a way that has influenced the overall status of the person's communication. The factors that influence that communication, whether expressly identifiable or not, can be attributed to some amount of complexity and, from there, can be solved rather quickly in terms of the location of that irregularity with respect to the standard behavioral index. In this way, the traditional mental illnesses can be reorganized based on the correlatable characteristic of communication being affected in each disease process. For example, the process of schizophrenia and its associated symptoms can be explained by a disruption, deactivation or lack of activation of the first characteristic of communication known as self-identity. The dynamics of the non-standard expression of self-identity in terms of the standard behavioral index correlate quite closely to the resulting behaviors and experience associated with schizophrenia and its manifestations, including the complex impulse or subtraction and hallucination, external association with meaningful identity and disproportional self-care. Standard theory refers to this non-standard process as dissociation, with the severity of dissociation correlatable to a specific amount of cyclic thinking. Bipolar disorder, in terms of the physical type, is closely correlated to a non-standard experience of the second characteristic known as the self-interaction. The expression of this characteristic in a non-standard sense is referred to as intimacy dysfunction or the repeated failure to communicate in a one-on-one fashion. The lack of self-interaction and the correlated level of cyclic thinking correspond very closely to the manifestations of physical type bipolar disorder, including the depressive withdrawal from interaction as well as the manic frustration of continued communication failure and intimacy dysfunction. The non-standard activation of the third characteristic as well as the consideration of deactivation, lack of activation or prompt for communication during either lack of or deactivation can be correlated to several discernible conditions in the traditional sense. These include the processes of obsessive-compulsive disorder as an attempt to resolve the interval between self-interaction and self-orientation, the processes of attention deficit as the continued deactivation of the third characteristic during the prompt for communication, attention hyperactivity as the overactivation or the third characteristic with or without prompt for communication, as well as depression as the continued lack of adequate activation of the third characteristic without prompt for communication. Each of these traditional illness can be directly related to the non-standard experience of the free will interval. The non-standard activation of the fourth characteristic can be directly related to the process of depression, defined as disproportional interaction through avoiding or forcing that interaction, and anxiety, which is defined as the process of replacing intimate identity with intimate interaction. The fifth characteristic of communication is related to anxiety in a complex sense, as the disproportionate interpretation of a situation during a prompt for communication can be irregular enough to deactivate one or more characteristics based on stress. This process, if severe enough, can be directly related to either anxiety or post-traumatic stress disorder. The abnormal experience of the sixth characteristic can be directly related to the traditional process of autism. Standard theory defines the basis of autism as a disproportional amount of processing related to the overload event experienced at the sixth characteristic. The overstimulation of this process as well as understimulation of this process can change the way that the experience of one-on-one communication as well high-energy processing and intelligence is handled in general. This can lead to the observed behaviors of those diagnosed with autism in terms of overly extended cycles of high-energy processing or otherwise overly extended lack of these processes in relation to observable behavior. Furthermore, the observational diagnosis of autism in terms of a non-specific behavioral abnormality can be more closely attributed to either another non-standard process or as a result of three-party shared intimacy in sorting the true source of the abnormality by either the parent or practitioner. Using a correlation to the presentation or associated symptoms of traditional illness, a comparable process as organized by the Standard Behavioral Index can directly identify the root cause of the presentation. From there, using the concepts of STEM psychology can not only address the exact magnitude of that process but the complementary amount of treatment needed to correct that problem. This allows the direct consideration of each condition on an individual basis with a repeatable and completely objective measure. Please join me in the next segment as we continue to explore psychological phenomenon from the standpoint of standard theory.